alarm number of new coronavirus cases reported in Los Angeles County in the last 24 hours is 9,473, with 22 additional deaths. Here in Torrance, 96 additional cases were reported with no new deaths. Welcome to COVID-19 Today. I'm Leslie Robbins, filling in for Rhiannon Chutanich. It's Tuesday, December 28th. California became the first state to record more than 5 million COVID-19 cases. New coronavirus cases and hospitalizations are exploding again across the state, with the average new case numbers jumping 73% from just 2 weeks ago. Such a rise in infections is taking a toll on hospitals. The latest data shows there are more than 4,700 hospitalizations statewide and over 1,000 Californians in the ICU due to COVID-19. We haven't seen numbers like this since early October. And nationally, 4 states, Maine, Michigan, New Hampshire, and Vermont, hit all-time pandemic peak hospitalization numbers this month. LA County Public Health Director Dr. Barbara Ferrer says the recent numbers make it crystal clear that we are heading into very challenging times over the winter holidays. Now, state officials say clinical and wastewater data indicate that Omicron cases are present in most regions of the state. At least 3 healthcare systems in California report 50 to 70% of COVID-19 cases are likely Omicron. They reinforce the importance of getting vaccinated, boosted, and taking necessary prevention efforts to protect against COVID-19. Well, despite high vaccination rates, the LA Public Health Department is seeing another rise in COVID-19 cases among healthcare workers. As of mid-November, 91% of hospital workers, 93% of dialysis workers, and 83% of EMS workers were vaccinated. And as of December 12th, 96% of skilled nursing facility staff were also fully vaccinated. But during the week ending on December 18th, 292 COVID-19 cases were identified among LA County healthcare workers, a 26% increase from the previous week. And about 46% of hospitals in the county are reporting staff shortages, compared to 20% at the outset of last winter's surge. Public health officials say the county's new health officer order requiring booster doses for all healthcare workers is a key protective step aimed at reducing future infections. The revised order requires booster-eligible workers in healthcare settings to be boosted by February 1st, 2022, or be tested for COVID-19 twice a week, beginning as early as this week if working in acute healthcare and long-term care settings. The order also recommends all workers to upgrade their face coverings to surgical masks or higher-level respirators, such as N95s. U.S. health officials cut isolation restrictions for Americans who test positive for COVID-19. Instead of 10 days, the U.S. Centers for Disease Control and Prevention says infected individuals just need to isolate for 5 days. CDC officials changed their guidance after growing evidence showed that people with the coronavirus are most infectious in the 2 days before and 3 days after symptoms develop. Their decision was also influenced by the recent surge in cases. Experts say the growing number of people becoming infected and therefore having to isolate threatens to crush the ability of airlines, hospitals, and other businesses to stay open. The CDC also changed quarantine requirements for close contacts. The agency now says people who got booster shots can skip a quarantine if they wear masks in all settings during that time frame. That means everyone else, unvaccinated, partially vaccinated, and fully vaccinated but not boosted, will still need to quarantine, although the CDC cut that time from 10 to 5 days as well, as long as they wear masks in all settings for the following 5 days. Medical experts say cutting isolation and quarantine periods to 5 days means there will still be people who are contagious. CDC officials say that is why wearing masks is a critical part of their guidance. The top U.S. infectious disease expert says the country should seriously consider a vaccination mandate for domestic air travel. Dr. Anthony Fauci says such a mandate might drive up the nation's lagging vaccination rate and offer stronger protection on flights. The U.S. currently mandates most foreign travelers coming to the U.S. to be fully vaccinated against the coronavirus. U.S. citizens and permanent residents only need to show proof of a negative COVID-19 test taken within a day of boarding. Federal rules don't require people traveling by air within the U.S. to show a negative test, although Hawaii requires travelers to test or show proof of vaccination to avoid a mandatory quarantine. President Joe Biden says the topic was discussed on a call with the nation's governors on Monday, but has not said anything else regarding the matter at this time. A new study shows that the coronavirus can persist in different parts of the body for months, including the heart and the brain. Scientists at the National Institutes of Health found the virus can spread widely from the respiratory tract to almost every other organ. They performed autopsies on 44 patients who died either from or with COVID-19 before vaccines became available, and tracked virus distribution across the body. The researchers say RNA from the virus was found in patients up to 230 days after symptom onset. Their findings are available online in a preprint manuscript and shed new light on patients who suffer from what's known as long COVID. The study found that the virus replicated across multiple organ systems, even among patients with asymptomatic to mild COVID-19. The virus was detected in all 44 cases and across 79 of 85 anatomical locations and body fluids sampled. Now, while the infection was most notable in the lungs and the airways, the virus also infected cells throughout the body, including muscles, nerves, and tissues. The researchers described the study as the most comprehensive analysis to date of the virus's persistence throughout the body and the brain. The New Year's Eve countdown at New York's iconic Times Square will still go on despite Omicron, but with less people and more rules. Viewing areas that normally accommodate about 58,000 people will be limited to just about 15,000 to allow more social distancing. And every attendee must show proof of vaccination and wear a mask. New York City Mayor Bill de Blasio says these additional safety measures will keep the fully vaccinated crowd safe and healthy as we ring in the new year. Omicron has spread rapidly throughout the Big Apple. New York had close to 55,000 new COVID-19 cases the day after Christmas, and hospitalizations topped 5,500 for the first time since February. Here in LA, the New Year's Eve party in downtown is canceled once again. Organizers for the celebration at Grand Park scrapped its plans for an in-person audience, saying the event will be live streamed instead, as it was in 2020. It can be viewed on Fuse and Grand Park's YouTube channel beginning at 11 p.m. The changes were made after consulting with the LA County Public Health Department. The flu season has officially arrived after taking a year off. Last year's flu season was the lowest on record, likely due to all of the safety protocols surrounding COVID-19, such as mask wearing, social distancing, and canceling schools, travels, and other activities. But now we are back on track and seeing hospitalizations go up again. Health officials also confirmed that 2 children have reportedly lost their lives to influenza. They said it's a sad reminder of how severe the flu can be. New data shows the most intense flu activity was in Washington, D.C., and the number of states with high flu activity rose from 3 to 7. The CDC says the type of virus circulating this year tends to cause the largest amount of severe disease, especially in the elderly and the very young. The agency urges Americans to get the flu shot and reminds them that they can do so simultaneously with a COVID-19 vaccine if they still have not gotten that shot. Other tips include covering coughs, washing hands, and staying home if sick. Well, humans aren't the only ones that need to stay safe from the flu. Canine influenza, also known as the dog flu, is spreading quickly across Southern California, and experts are warning pet owners to be careful. The Society for the Prevention of Cruelty to Animals Los Angeles says there's currently an outbreak in LA that's bigger than the last one in 2017. Animal experts say holiday reunions and boarding may lead to an even bigger increase in virus infection. Almost all dogs could get the canine flu, according to the CDC, and virus infection tends to spread among dogs in kennels and shelters. Dogs can get vaccinated against canine influenza as well. They're 2 shots taken about a month apart. And since masks aren't quite an option in this case, experts recommend that dog owners practice social distancing with their pets and not let them share food bowls or toys. They also say keep dogs away from others who may be experiencing symptoms such as coughing and sneezing. A dog flu can last 10 days, and though not common, dogs can die from the virus. Speaking of dogs, you may have noticed some if you were flying out of LAX over the Christmas weekend. Starting last Friday, the airport kicked off its LAX Pup Program again. PUP stands for Pets Unstressing Passengers. Get it? 4 dogs, Mia, Mason, Ellie, and Sirio, were out in their festive outfits greeting guests in the terminals. Airport officials say this Paw Patrol is helping travelers get through what might be a more stressful than usual period during the holidays. The therapy dogs and their handlers roam the departures level in the gate areas of each terminal, visiting passengers who are waiting for their flights and providing comfort, as well as airport information. They're wearing red vests that say "Pet Me" with the PUP logo. This program also helps passengers to stay in the loop on LAX projects and construction-related traffic impacts. Well, before we go, at the end of each program, we'd like to share more feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. Well, if you are looking for a fun way to end the year, the Torrance Rose Float Association has a unique opportunity open to the community. Entering its 66th float for the city of Torrance, the Torrance Rose Float Association will feature a majestic African elephant alongside a colorful toucan, which highlights the warmth and beauty of the animal kingdom while promoting awareness of endangered species. Now, volunteers are needed this week to cut, glue, and decorate the beautiful float before it makes its way down Colorado Boulevard. Decorating days continue through this week until December 30th, and volunteers are picked up and dropped off every morning and evening each day at the Torrance Civic Center. Participants must be at least 13 years old and must show proof of vaccination or a negative PCR test within the last 72 hours. To participate, log on to torrancerosefloat.org to learn more. You can also sign up by calling Debbie Vaca at 310-922-8769. What a memorable way to wrap up 2021 and prepare for the new year. Now, if you have a great story, upcoming event, a photo, or video you would like to share, email us at covid19today@torranceca.gov. We would love to hear from you. Well, that is our update for COVID-19 today. We will see you back here tomorrow as I return to bring you the latest. Please be safe, stay healthy, and thanks for tuning in. We will see you next time.